We are always looking for volunteers that want to serve from the heart, and that volunteer will be a person that wants to come and make a difference in the lives of other people. And there's so many ways in a hospital setting that you can make that difference. It may be by just giving someone a warm washcloth. It may be by giving them a warm blanket. It might be a smile. It might be just taking them to their location because they don't have any idea where the radiology department is, or the lab, or the cath lab. They need someone to greet them at the front door and make them feel welcome and that they're going to be taken care of. There are so many other areas in the hospital that we have volunteers. We have volunteers in the maternity care. We have people that cuddle babies. We have people that work in the emergency department. We have people that work in administrative areas like human resources, in the foundation. There are so many opportunities for people that really want to make a difference and give back to the community.
The purpose of the gift gallery is to give back to the hospital. This is such an exciting opportunity. The volunteers give back by being here in the gift gallery, serving the customers, stocking, having their bright shining smiles every morning and every afternoon. We're filling this gift gallery up with lovely gifts. And hopefully as people take their gifts out, they'll recognize that not only are they leaving with something that hopefully they will enjoy or enjoy giving, but that they're also giving to the hospital in the way of the purchase money. So all of the funds that are profited through this gift gallery are actually given back to our hospital.
Mostly I work in the gift gallery, and there we sell snacks and gifts. And a lot of our gifts are unique. People are really excited when they come in and see them. And we run messages, and we fill in for the front desk and find out where people are located for the visiting guests. This is my son Blake, and he started as a junior volunteer about 4 years ago. And he was thinking he might want to do something in the field of medicine.
Well, it's been a really fun experience, actually. The staff is amazing, and they help you like whenever they can. They will go completely out of their way to make sure that you have the best experience possible. And there's no downsides to what you do here.
I get a real satisfaction out of it. People are always happy to see you. And sometimes people come in just to talk. You know, they're waiting for people to get out of surgery and what have you. And they come in and browse and end up talking. And it's just a good interaction with people in a positive way.
Volunteers come in all age categories. We have over 100 junior volunteers from high school that come and are volunteers here during the year. We also have many college students that are going into a health-related field, and they're looking for experience and wanting to know, well, what would it really be like to be in an emergency department in real life? And then we have other volunteers that are perhaps moms that are looking to add something to their life. And then we have volunteers that have taken early retirement. Then we have other volunteers that have been retired for some time, but they have found great satisfaction and fulfillment in being able to come and be a volunteer and give something back. It gives meaning and fulfillment and enrichment to their lives. We're starting a new program this year called Angels in the ER. The purpose of this is for volunteers to be able to be a liaison in the emergency department between the family, friends, and the patient. And they'll be able to round in the emergency department and come out and share information with the people that are waiting.
Often here in the emergency room, we're so much into the emergency care. As far as the human touch part, a lot of times because we're so much into the emergency mode, that that part is not so much addressed.
To us as physicians in the emergency room, having a volunteer is a great help because they can be an additional person to talk to, sometimes and a lot of times a shoulder to cry on, that because of time constraints, we're not there to do. Not that we don't want to do it, we just don't have the time, a lot of the time, to be able to do it.
They would be doing rounds in the emergency room, hourly rounding, and to see what the patient needs are or the family needs are.
We have a new program that will start. The title is No One Dies Alone. The purpose of this will be for volunteers to be a compassionate companion to someone who is at the point of death with no family that is available or present to be able to comfort them and sit with them as they pass. We do not want a patient to ever be left alone to die when somebody could sit with them, just being a presence for that person, just making them feel comfortable, holding their hand, just being there so that they're not alone, because this is one of the greatest fears that most people have, and that is to die alone. A volunteer is someone who has a heart for compassion and service, and I would just like to invite volunteers to come and be a part of what we have to offer at San Joaquin Community Hospital. We offer you the opportunity to come and be a partner with us and share in making a difference in the lives of our patients and their families.